41 years ago, we began providing primary medical and dental services here in the South Valley. Today, we're located in 3 counties. We're located in Bernalillo County, Valencia County, and South Santa Fe County. We service the adjacent counties as well. We draw from approximately 6 counties. So we've really expanded our catchment area. And with that expansion, we've expanded our services. We've added behavioral health. We've integrated behavioral health within the context of the primary care visit. So there's no stigma, there's no difficulty in receiving the care. It's a part of your physical care that you receive at First Choice.
I'm a licensed clinical mental health counselor. Started out life as a minister, but for the last 30-some years I've been providing mental health counseling and serving as executive of behavioral health services. So coming on to the First Choice Board, I was very interested in figuring out a way to pair the primary care medical services with behavioral health services, and First Choice has really led the way in this community, I think, for creating an integrated model of behavioral health and primary care medical care that makes it possible for people to really meet 2 sets of needs that often are very closely entwined.
First Choice has developed into a tremendously appealing alternative to people across the board of medical consumers. I realized the name First Choice was at one time a dream, that is, that these clinics would become a viable choice for people across the medical spectrum. In fact, again, under the direction of Mr. DeFelice, that has become the case.
We not only want to provide the best and the highest quality medical care services to our communities, we want them to access this in beautiful facilities, state-of-the-art facilities. And we want our staff to feel good about where they're working as well. We think it's an important factor that's often overlooked. And so we've made every effort to work with partners to acquire the necessary funds to build these types of facilities that people are very proud of in their communities.
It's an extraordinary thing to hear people say when they come here, I never knew that this place was here, and it was so incredible. This is the nicest medical facility I've ever been in, and everyone deserves that. So the fact that we have facilities that reflect the quality of the work that we do and the care that we provide is pretty incredible.
And where we're at currently in Edgewood, we've already outgrown that center, and that's our next job, is to be able to find funding to build a new center. We're in the process of locating property there to be able to build on and to be able to provide the best services we can for Edgewood also, because they're growing.
The fact is, in the East Mountains, there's just a limited amount of health care available at all, regardless of your economic circumstances. There's just not a lot of health care providers out there, and so our patients in Edgewood come from a broad economic range, a broad socioeconomic range, which is somewhat different than it is at some of the other clinics.
And it was interesting because Donna came to me. We were trying to connive some way to get building space someplace out there. And then basically Donna said, hey, guess what? Someone came into the UNM clinic outside the Cottonwood Mall and said, when the Cottonwood Mall was being developed, and said, I'll buy this real estate from you, I'll give you X amount of money. So the university started conversing with them and realized that's a lot more money than those buildings are worth to us. So the university sold them the property, and they were going to break the buildings down and knock them down. So we found out that the university could sell the buildings to the town of Edgewood for $1. And then we worked out this plan where the Edgewood bought the buildings for $1. They moved them in 6 pieces to Edgewood, and then First Choice put $150,000 into putting the buildings back together to form a clinic. So we went from nothing to all of a sudden a 10 exam room clinic with an area for dental care and everything, almost as a gift.
it benefits the community by having people know that they're not going to fall through the cracks, that there's something here available to them. They don't have to go into Albuquerque or Santa Fe and spend their money on gas and have more time used for Albuquerque treatment. It's all right here, and it's all available to them if things come to fruition the way we want it to.
In the Edgewood area, there's a combination medical and dental facility there. They have 2 dentists there. I'm not sure exactly how many medical providers, but they actually are a big part of the dental community there, where there aren't that many other dentists who practice in that area, and so they have a lot of patients coming through who they don't have access. They wouldn't have access to a dentist at all if they weren't available in that area.
I think another great part about working here is that we take care of an entire cross-section of society. We see patients with private insurance, with public insurance, with no insurance, people who are working, who are in leadership positions in their organizations, people who are not working, who are looking for work. I've spent time as a medical student working with Dr. Sava, who was one of my mentors and actually inspired me to go into family medicine in Edgewood, and you see the entire gamut. You see that entire cross-section. Here in the South Valley, the same thing, with some of the changes that have gone on around provision of care and relationships with various healthcare organizations and insurance companies here. We have a large influx right at the time that I arrived of insured private insurance patients.
We've been very successful in identifying providers and retaining providers. I think for many reasons. You know, one, I think because of the uniqueness of our programs and the communities that we serve, but I think also because of our philosophy of allowing providers an opportunity to really get involved in more than just the delivery of care on a daily basis, to get involved in understanding the community, to get involved in special projects that impact the community, to have a relationship with the University of New Mexico School of Medicine and pursue other interests they may have. To get them involved in such programs as ECHO, where they're trained and allowed to deliver a level of subspecialty care that may be of interest to them as well. So I think we've been very successful there, but it's always going to be a struggle, you know, because we're in competition to identify a provider group, and we're competing with other systems that need providers as well. And with the provider shortage that exists, not only in the state but throughout the nation, it's a challenge. Now, one of the things that has been very important for us is our relationship with the University of New Mexico residency program in family practice and internal medicine and now in pediatrics, where we're able to offer residents a community experience.
So that piece then evolved of developing the Teaching Health Center and the Teaching Health Commons. Now, that's not a trivial point because, you know, through my work and through the work with people like Dr. Kaufman and stuff, community health centers have done a good job of being out in communities. But being out there in communities hasn't necessarily meant they know how to partner with communities and provide services in communities, you know. That's a whole thing that has to still be learned, you know. So this opened the door to be a great experiment, and how do we develop that then? And that's where we came up with this concept of a health commons, right? That it's not just being out in the community, and it's not just having a couple of different service entities out there in the community. It's how do you really create a structure that gets the different service entities in the community to know how to partner and work together.
And that's definitely a goal of what we do here, is to get more doctors working out in community. Now what we're realizing is it's also important to make sure that they're well qualified and have all the skills that they'll need, not just to practice medicine in those communities, but also to be active role models in the community and try to affect the health of that community on a broader scale than just in the individual clinic rooms. We're very proud of the number of patients we see on an annual basis here. Our residents are proud of the volume of care that they provide, and all that's excellent medical care. Nevertheless, it only touches a small fraction of the amount of people who are living here and the problems that this community faces. And so if we can develop a way to teach these residents, all of whom are deciding to work in communities just like this all throughout the state, how to recognize the other problems that their patients face and have the skill set to then try to solve those problems, then we can affect health on a much broader scale than just, simply clinic visits, addressing medical problems, high blood pressure, diabetes. Those are all valuable things, but there's also a lot to be said about how do you address poverty or educational levels or food deserts, or all of the kind of hot topics that we know really influence the way our patients experience a healthy lifestyle.
I hope I'm a mentor. I think that just being a physician in this community, in this type of community, I think I do offer that, hey, maybe I can be like Dr. Cisneros. I do a lot of teen clinics, and I always ask them, like, what do you want to be when you grow up, And I think that's important, to see somebody who kind of looks like you, who talks like you, and see them as a physician. I think that's important. Growing up, my healthcare was it was in a mobile clinic in Little El Mirage. So it wasn't even a permanent place. It's just this mobile clinic that came in and out. But I never saw anybody that looked like me, not a female and not a minority. So I think it does make a big difference in these, especially adolescents. And once I speak Spanish, because my Spanish is not it's not fancy. It's homegrown kind of Spanish, and so it's what everybody understands. And I think once I speak Spanish with my patients, they hear that tone, they hear that, oh, okay, and they kind of open up a little bit more with me and let me know the real experiences, because it's hard, especially in our culture. When you talk to a physician, you want to say the right things, you want to do the right things, and they don't want to feel like the physician is judging them. But when they see that you're kind of like them, then they're okay. It's like talking to your comadre. Yeah, this is what's going on in my life. So I think it does help patients open up a bit more.
And First Choice has really been a model that's taught us a great deal. The University of New Mexico School of Medicine was ranked 3rd nationally in the percentage of its medical school graduates who chose family medicine residencies. And so we looked at it, well, why is that? Why are we doing so great? And the reason was, 1, they were exposed early and often to primary care and family medicine role models. 2, they were able to work in centers like First Choice that are so exciting. You have to see that, and when you watch ER and television, that's not the only exciting part of medicine. It's actually more here. And they were able to see a whole different reality that didn't appear in the hospital. And so if you look at so many of our trainees have learned here, 2/3 of the physicians at First Choice are actually our graduates. So this, as Dr. Romero-Leggett said, this is really growing our own, and they are terrific doctors.
Since then, we've had 25 residents who have gone through their 3 continuity years of training in family medicine through the University of New Mexico. We've graduated 14 of those, and I believe 11 of those are actually in primary care, like FQHC, like IHS settings, and 11 of those also have stayed in the state. So we've also had people who've gone to Chicago and work in FQHCs in Chicago, inner city Chicago, gone into Arizona and work in FQHCs in Arizona, in Denver. But I'm kind of biased, and I want to retain those providers as much as possible in our state, because I believe that we train great providers and we want them to stay in our state. And even better, if they can stay with First Choice, even better. So that's my main goal. But I think the main idea is to really prepare primary care providers to work in their communities, and also to make them feel comfortable working in those communities.
First Choice in particular really was the only choice for me in terms of coming back. I wanted to be based in a place that had a real feeling of community, and from what I've been learning and what I've known growing up about the South Valley, is that there is an incredible sense of community here. It's a place that faces a lot of challenges, but has people that have been working for generations to improve wellness and health in this area.
So that's where First Choice has developed this concept, which even goes beyond the patient-centered medical home. This is really a health commons. And what that means is we're putting together and integrating primary care, behavioral health, oral health, case management, and public health, and all the outreach activities. So First Choice is a real model because it's looking at economic development locally. It's looking at youth development, and that's why it connects with local school systems. And so we want our graduates and our students to see this model. That's the model for the future, and that's why so many are attracted here.
You know, the Health Commons is a model that we began to develop about a decade ago. And the intent of the Commons was that we felt it important to try to locate or co-locate a number of resources that were important for the community to access in a central location, easily accessible. But the Commons model went beyond the fact that we were going to co-locate various practices like public health, First Choice, our Women, Infant, Children program, and other related programs. It went beyond the concept of just co-location. It included integration of those services, and that's the key to the Commons. The underlying theme is how do you maximize the collective resource of a number of organizations for the betterment of a community.
In building the Health Commons, which has been a very wonderful experience, a very wonderful expansion, is that they are also expanding the educational horizons. They're expanding the behavioral health programs. They're expanding the wellness programs, which we eventually want to have a place where people can, you know, think about having, you know, going to the gym, going for walks. They're also wanting to have a place where we can have exposure of the arts that the people have in the community, bring childcare into the Commons area as well.
I mean, we do a major thing called warm handoffs, where rather than sending, you know, a patient or a client, oh, go down the hall to that other service, it's really saying, hey, can I bring another partner into the equation here? A lot of times in the warm handoffs process in the Commons, you don't bring the patient someplace else. You bring the other worker into the room you're at with the patient, and you say, hey, this is a member of our behavioral health team that we think can help. Can I leave you a couple minutes with them? And then they might say, hey, you know, can we talk more? Do you mind coming over to my office? You know, someone will come into public health, for instance, that might, you know, have a problem with heroin abuse. And they're coming in for their harm reduction programs, which are great programs, you know. And then they'll identify someone who might say, you know, I'm really ready to start dealing with my addictions. And then they'll say, hey, can I bring another team member in that works with folks with addictions? And then they'll hand them off to our, you know, our Sangre de Cristo counselor worker who might engage them. You know, and then the next level down the road many months might be when their addiction's treated. Hey, you know, it sounds like you got hepatitis C from your addiction. Can I hand you off to one of our docs who does hepatitis C treatment? And then there are all those other partnerships that expand Commons. So our partnership with Project Echo, you know, doing community-based treatment. It's just amazing to me that I think in 5 of our sites now, you can go get your hepatitis C treated. You can get your rheumatology treated. You can get your addictions treated, you know. That's what Health Commons is about.
One of the nice things to working at First Choice is that we have the ability to collaborate with the medical providers here. They will have us come look at things where they don't recognize what's going on in a patient's mouth, and we can say, oh, I see that all the time, that's normal. Or we can say, you know, I'm really concerned about that. That is not normal, and we need to really help this patient follow up and get the right care.
Currently, we have a small wellness center within the existing Health Commons structure, right within our clinical practice. And Dr. Brian Shelley is our wellness director, and he's mounted a number of wellness programs to date, which include mindfulness programs for staff and for community members and others, diabetes education programs. We have massage therapists coming in. We're dealing with stress management. He's doing a number of pain reduction clinics. So a lot's happening at the current wellness center. And our other sites at First Choice are referring clients to this small wellness center.
So some of the projects we have going on are related to specific diseases, and some things are more general and not related to a disease per se. For example, we have mindfulness-based stress reduction classes here at the Commons, some for healthcare providers, some for patients, and no one needs to have a specific diagnosis to get into these courses. They're for people who want to reduce their stress.
And so part of mindfulness-based stress reduction is just this idea of being able to slow down and pay attention to what's going on in our experience, and that can help us make more conscious decisions about living in ways that are more valued and directions that are more valued in our lives. And I think, and ultimately just leading to health. I mean, we know that regardless of anything else, regardless of age, ethnicity, location, anything like that, socioeconomic status, that going a million miles an hour like we have to do and multitasking all of the time and having so many demands, that we know that that's not good for health. And we're learning more and more about that, about the extent of that impact and what kind of ways that that kind of lifestyle without a lot of rest and with a lot of stress can lead to maybe even worse impacts than we thought on health long term.
We did recently go through some of the things that we did was I was referred to a mindfulness class, which I loved it. It was like because of the fact that, you know, in our stressful world and things that are happening in the world, you know, we're burdened with financial things, you know, the worldly effects of the hustle and bustle of getting a job or keeping a job or your family and those kinds of things. It really puts a toll on ourselves sometimes. And this was recommended to me because I was going through a stressful time, and, you know, I create anxiety, and, you know, it comes to me naturally too. So we went to the class, and it's an 8-week class plus a 1-day full retreat. And oh my goodness, it was awesome.
I feel that First Choice offers excellent service to our community. Just the fact of us having the indigent program, people that can come in from all walks of life, whether you're insured or uninsured, because we do offer the sliding fee scale discount, I really think that helps a lot. Because it's really tough to see older people having to choose between, do I buy my medications or do I go to a doctor's visit? And it's nice that we can offer the fact that you can come to your doctor's visit, get it at a discounted rate, get your medications, and still afford to buy your food. It's a scary thing to think that you can't afford to go to the doctor, but it's a nice thing to know that you can go somewhere that's going to try to help you out and give you that discount.
It's family. It's family, and I think that's the connection. And also when you hang on to these young families and they grow up, they grow within the center and people get to know them. So it's a family setting. And First Choice is named First Choice because we want that primary health care to be their first choice at First Choice Community Health Care Centers. We want them to know that they're getting the best care there, that when they walk into those centers, they're going to know people. And if they're not going to know people working there, they're going to know people who are patients there. And I think that's what draws people there.
And then my wife finally found First Choice. And they put me with Dr. Cohn, a wonderful doctor. Oh, I think the world of the lady. She's been there for me, has taken good care of me. This place here is wonderful. The people, I am amazed at the friendship and the kindness.
You know, at First Choice, you know, we have been delivering very high quality care, both medical, dental, and behavioral health services to the community for many, many years. This is our 41st year of service delivery in our communities. And while we continue to expand that service delivery model and offer more and more services, including some subspecialty services now that we provide on site, we've recognized for many years that provision of service alone, providing access to these needed services, while important, a critical part to the wellness of communities, isn't the only part of the puzzle. There are other pieces.
Well, let me say that First Choice, not only being a leader in medicine, not only being a leader in terms of how it interacts with the community, is also now stepping up to a different level of participation with the community and partnering with other entities to hopefully in the near future have a charter school that is on First Choice property. Now, that is important because that partnership and that charter school is going to be medical driven, so that young people, high school students, will be able to get an early introduction and presentation to what the medical field is really about.
The relationship with First Choice developed because First Choice is a very entrepreneurial organization. So they really think about how they can position themselves in the community, and they saw the opportunity of health leadership and the way that we think about young people and the way that we think about the community. And I think First Choice looked at our mission and our vision for the future and saw that there was a natural partnership there. And because they're so entrepreneurial in the way that they think about it, I think they jumped at the chance to work with us. And I know that it was a great opportunity for us as well, because they really think about health in the same way that we do. And I think it's a great opportunity to learn from each other about a better environment for our community.
Health Leadership High School defines health not just in the areas of health care, but in making our communities healthy. So we have designed our curriculum with industry partners and into 3 domains of health. One being clients, which is anything that's directly related to patient care, and determinants is any of the social determinants that are associated with healthcare that affect our own health in our communities. And then systems is the 3rd domain, which is our health systems, which includes hospital insurance systems, etc. And so the 3 domains will be embedded into our curriculum so that students really understand health from all different lenses.
And I think it's a great marriage that we're going into right now. It's going to be a very interesting venture. Myself being a former educator, I think it's a great idea to bring a charter high school onto one of our sites and show them what we've got. I think it'll be great for internships to be able to have these students come through our centers and find out what we provide.
I'm really excited of our facility being with First Choice on their campus because it provides a place for the students to really get involved in the hands-on approach of health and health care on a day-to-day basis. So rather than reading it in a textbook or getting on a bus to go visit a site, they actually will experience it in a very real-life, real moment-to-moment basis in seeing people from the community working out in the wellness center, helping with hands-on if they see something that they're really interested in, physical therapy or in patient care or whatever the case may be. The students having access to that 100% of the time, there's no other way that it would be so beneficial to our students in our community than to provide that for them.
And the reason that I really am on the board of Health Leadership is that I really believe that not only do we have an opportunity to prepare young people for a career in the health fields, that's certainly the big outcome or the big goal that we want. But for me, if we have 400 young people every year who know about their own health needs, who can help their families access the health systems that are available out there, if we have young people who take better care of themselves physically, emotionally, etc., that's important to me. And so that's another reason I'm back here, is that I want to see health leadership not only be a place where young people thrive, but I want it to be a place where their families get support, information, awareness, better knowledge of the health systems. And now as the Affordable Care Act expands and we start seeing more opportunities for people to access good health care, this is a place where we can provide a lot of guidance, a lot of support, and hopefully we will be a model for how you help young people not only learn what they need to in school, but how they can learn how to help their community.
When I heard that there was something as the healthcare high school, I was so excited because I wish that opportunity would have been offered to me. as I was going through high school.
So our approach at Health Leadership High School is very different from the traditional model of any kind of career academy or tracking of students. We don't have, in traditional systems, it tends to be that you can take elective classes in certain fields that you're interested in. So you could go take electives in health or in nursing or what have you. And our school is designed very differently, where the whole curriculum centers around health. And so students learn all of their content and subjects of math, social studies, language arts through the lens of health. So it's not like if they do well during the traditional class, they get to take an elective at the end of the day. Rather, it's embedded into our curriculum on a day-to-day basis. And we have industries in the community coming in and working with our students on a day-to-day basis as well. So they have that real-life experience. They don't have to wait for something to happen before they get that kind of experience.
I see myself working in a clinic, a hospital, or somewhere in the medical field. Well, the way I was interested in nursing was because growing up in the First Choice community with my mom and dad, I actually really liked the environment, and it kind of seemed natural to oh, okay, I like how the environment is, so I want to be a nurse.
In anticipation of a growing need to access care in our communities, we've spent the past many years fostering strong partnerships with various community groups, with local government, with the County of Bernalillo, with the state, and with our federal partners as well, to identify resources to allow us to expand capacity to serve.
First Choice Community Healthcare is clearly a wonderful example of how our investments in community health centers are making a difference.
You have to be efficient. You have to use your dollars wisely and effectively. But by the same token, you don't want to do that in a way in which you lose track of your mission. And that's a difficult process. And I think Bob has done a very good job of that, in that we want to use the dollars we have to provide as much health care as we can to as many people as we can. But by the same token, we want to do it in a way that is consistent with our mission, that people feel welcome coming here, and that we lower, at least, if not eliminate, some of the barriers to getting health care other than just the pure economic ones.
I think it's a very rare thing to have a leader or a leadership group of a healthcare services organization think about health beyond just providing those services. The easy thing to do for sure is to think about how do we provide those services the best quality, cost-effective way and keep our doors open. It's much more challenging and visionary, quite frankly, to think about, well, wait a minute, it's not just our services that are impacting people's health. It's education. It's whether or not people have jobs. It's whether or not people have access to food. So when I came across Bob DeFelice and really learned about his vision of health, I knew I couldn't be anywhere else.
At First Choice, we've made the commitment to partner up with those innovators in education and those innovators in helping people train for good quality employment.
The Workforce Training Center allows us to really build up the skills of our workforce in this rapidly changing healthcare environment. And we also train medical interpreters. So we have highest quality medical interpreting in each of our sites in English and Spanish. And we do things like teach them how to do lab work so that we can provide that service in our health centers at very little additional cost to the patient. So we do a whole lot of lab work in each of our centers. The new medical assistants and lab assistants get their training here to learn how to do that. We also train managers and leaders of the organization to keep up with the changing demands of healthcare and all the reform that's going on, so that they can be the leaders that we need at each site to really increase our capacity, increase our productivity so we can serve the public even more than we are. So we've got a computer lab here where we teach everyone how to use the new electronic health record system. We're moving each of our sites onto the electronic health record system over the next year.
So the future of First Choice is really changing a bit. We will continue to be diligent and deliver high quality core primary care services, and we'll expand that scope of service as we should to address changing community needs. But we're not going to forget that there are other factors that influence individuals' health, and we can play a role. And through partnerships with others who have resources and who have a commitment to addressing other social issues, we can help. And we're going to be an active member in that process.